Good afternoon, everybody, and happy Earth Day. Welcome to today's panel discussion. I am Dr. Marcel Davis, the Director of Diversity, Equity, and Inclusion here at VCU Health System, where we are focused on promoting and advancing DEI throughout the health system and the communities we serve. Our goal is to ensure that everything we do, say, and touch is done so with equity at its core. I am honored to moderate this discussion with my brilliant colleagues today. Our panel is in honor of two important tributes. But before we begin, please note that we will take all audience questions towards the end of the discussion. So feel free to add any questions throughout the event in the comment section and we'll address them in the order received. So as I mentioned earlier, today's discussion is in honor of two important tributes for the month, which we'd like to recognize both here, National Donate Life Month and Celebrate Diversity Month. But we wanted to do something a little bit differently because we wanted to integrate these two topics to raise awareness and provide education on both. So I wanted to start by sharing some critical information. Did you know that currently 58% of individuals on the National Organ Transplant waiting list are Black, Indigenous people of color? Additionally, the number of organ transplants performed on Black African Americans in 2019 was only 25.8% of the number of Black African Americans actually waiting for a transplant. Let's compare that to the number of transplants performed on white Americans, which was 47.6% of the number actually waiting to receive one. This is one of the many reasons why talking about diversity, equity, and inclusion as it relates to being an organ donor is important for the health and well-being of all individuals. And over the years, we at VCU Health System have become a trusted provider of transplant services to minority patients, with our heart transplant program being a national leader in providing life-saving care to Black patients. So I'm humbled to partner with my esteemed colleagues who took time out of their busy day to celebrate Diversity Awareness Month and National Donate Life Month. I'm honored to introduce them to you today. I just want to introduce them by name, and then I want to ask them to introduce themselves to you. This topic is personal, and you may want to get your tissues out. Harold Harris Jr.
Thank you, Dr. Davis, for the opportunity, and thank you for having us on this panel. Again, my name is Harold E. Harris Jr. I am a native of Richmond, Virginia, and I've been at VCU Health System for about 14 years now. And I've spent most of my career in IT, but up until coming to VCU, I had very little experience in healthcare IT, working in a hospital and setting. And I can tell you it has been a phenomenal opportunity, and it's been both challenging and rewarding because I work in IT, but I've also been a patient here. And in this opportunity of giving in spirit, the loving tribute that we were honored to be able to share with our colleague that Dr. Davis is going to introduce, I'm simply humbled and honored to be here, and thank you for having me.
Harold, thank you so much. Your story is so personal, and I'm honored that you agreed to share it. So thank you for being here.
Glad to be here.
Reuben Southall is our next panelist speaker. Hey, Reuben.
Hey, good afternoon, everyone. It's a blessing to be here. My name is Reuben Southall Jr. In terms of my personal background, I was an Army brat. The way I tell the story, I did elementary school in Germany and I did high school in Panama. So that's kind of what my life was growing up. My father was in the Army. In terms of my professional career, I am a child of VCU Health. I've been here over 30 years, and I'll just go quickly through the list just to tell you quickly what I've done. I started in patient transportation. I was a clerk in the OR. I worked in the anesthesiology department and data entry. Then my career took off when I became a programmer in IT, then a programmer, analyst, team lead, manager, director, associate CIO, then a director. So VCU Health is part of my professional DNA. I love this organization. I'm dedicated to this organization. They have educated me. They have nurtured me and mentored me. And I'm happy now to be the Director of Business Systems. And I'm looking forward to sharing today. These are very important topics, and I want to educate folks and alert folks to the circumstances that particular demographics experience.
Reuben, thank you so much for walking us through your journey here at VCU. That's so important. I appreciate that. Alicia Machado.
Hi, good afternoon. I just want to say I am truly humbled to be here with Harold and Reuben. I'm an ICU nurse. I've been at VCU for 6 years now. This was a second career for me, and I am the co-chair of the Leaders for Education and Awareness of Donation Committee, which is a nursing-based committee on the hospital. I also do work with the organ donation committee at the hospital. And so this is truly a passion of mine, and to be able to speak on donation and diversity with practically famous donation recipient payer at the hospital is truly wonderful. So thank you for having me.
Of course, Alicia, thank you so much. And thank you for all the great work that you're doing.
Thank you.
So colleagues, I'm so excited to be here with all of you today. I literally can't stand it. And I have to tell you that when my colleagues and I began to talk about what we would do to celebrate this month and honor it and pay recognition to it, this story was the only one that was on the table. I absolutely agreed. Even though I had only been here, I've only been here a little less than 6 months. I remember seeing your video during my onboarding, and I cried then. Then when we met, I think it was last week for our prep, I almost cried again. So your story was the only plausible answer for today. So your lived experience is so incredibly profound, and this partnership and this conversation is so impactful. And so thank you again. I'd like to start by asking each of you, can you tell me a little bit about your personal background, your role here at VCU Health System, and what makes this month special to you? Harold, do you mind starting us off?
I was getting ready to pivot and go ladies first, and I was getting ready to toss it to Alicia, but since you put me on the spot, okay. My journey here at VCU started back in November of 2007. And working in IT and coming into this organization and managing the service desk for IT was the beginning of my journey here. And since that time, we've done a bunch of different roles. Most notably, over the last year and a half, last 2 years, I transitioned from the service desk into a brand new role that was created by our CIO, CTO, and our Director of Technology and Engineering Services, called end user computing. And because I love analogies, they help paint a picture. I just give you my 2-minute speech on what end user computing is. Imagine, if you would, that we had a big umbrella, and under that umbrella, you had 6 different buckets. Well, I have 6 different teams that represent every single component of what touches your desktop, laptop, mobile device, everything that you work on. I represent those 6 teams. First team is video conferencing telemedicine. Second team is SCCM. That's a fancy word for all of the applications that are pushed to your desktop, all of the versioning updates. So when you need Adobe updated, when you need Microsoft Office updated, when you have a security patch that needs to be remediated to your device, that team does that. We have Citrix remote access. Now that group is really important because we went from having a couple of 100 people working from home to 6,000 in the blink of an eye due to COVID. So having a group that represents the VDI infrastructure that allows folks to work seamlessly at home, that's another group. The third group is our fourth group is messaging services, your email, all of the stuff that goes on with your email and things that work and things that don't work. We have a group that handles that as well. The other group that I'm really proud of I'm proud of all of them, but particularly this group, our SharePoint, OneDrive, and Teams group, because they helped enterprise communication transition that 1975 website that you used to have for the intranet that we used to see into what you see today. So we're part of the team that works on that. The other group that we have here is mobility services. They are very special to us as well, because when patients could not see their loved ones, it was our mobility services team that made sure that ICU nurses had the mobile devices so that people could say their last goodbyes. And that was incredibly challenging, but it was especially rewarding because we had a part in playing in helping someone at least be able to tell a loved one goodbye when they couldn't be there physically. So those 6 teams represent what is called end user computing. So now, you know, and you know where to find me. So if there's anything that's going on in the end user computing space, we're here to help. We're here to help you.
Wow, Harold, that's a lot. And I thought about
It was a lot.
that, you know, that you told the story about the mobility services and the impact that it's had on the patient experience. How profound is that in this age of COVID to be able to provide that service? I can't imagine.
It's especially rewarding. And because we have not only a professional tie, but I have a personal tie. Back in 2013, I had an emergency laparoscopic appendectomy. And so if it wasn't for VCU, I might not have been able to be here because I was a stubborn patient, just like any man. Oh, it's a bellyache, throw some dirt on it, it'll be fine. Wrong answer. My white blood cell count was 50,000 and my appendix was about to rupture, and it would have been a very bad day. And not being familiar with sepsis then, I'm very familiar with what sepsis is now, and that's not a good thing. So being a patient at VCU and watching the brilliance of the nurses, of the doctors, of the administrators, I have a very special tie to this place, in addition to this special and unique bond with Reuben, and being able to be privileged enough to be considered to be an organ donor. It makes it a very special place to me in more ways than one.
Carol, thank you so much for that intro and information about your role. Alicia, can you share a little bit about you and your role here at VCU and what makes this month special to you?
Absolutely. I knew in nursing school that VCU was where I wanted to be. Unfortunately, there was a hiring freeze when I first graduated. A couple years later, I was able to begin work in the neuroscience ICU. And it was just the greatest experience. I just felt like home. I take care of patients typically who are either post-stroke or head injury. Unfortunately, as far as organ donation, most of our patients are deceased donors. So really it's caring for families whose loved ones unfortunately did not survive whatever event they had and are now making that ultimate gift, sharing their loved one's life with other recipients. And it's, I think the first donor family I took care of just really made me realize how special and important organ donation is. So in 2017, I joined the Organ Donation Committee and I became co-chair of our lead committee, which focuses on providing education and awareness of donation and the processes the hospital has implemented to other staff members, members of the community. We do sign-up drives to get people registered to be donors. It's really been a very humbling process to work with people who are so ready and willing to give a part of themselves. I don't have as much experience with living donors, but I am just truly just humbled by anyone who is willing and able to sacrifice a part of their body while they're still alive. It's just amazing. And in this experience, I've really seen the disparity and the misinformation and mistrust in the Black and Brown community. So that's always been an important topic that I try to bring up, at church, social gatherings, just, not in a weird way, but just, anytime I hear misinformation to try and let people know how hard our doctors work and nurses, and the huge sacrifice and honor that members of the community have already made. So this month is really, really touching to me because I get to showcase what I do with my friends and colleagues. So thank you.
Wow, Alicia, thank you so much. So you carry our message in the communities that we serve, which is so incredibly important because
Absolutely.
Your role extends beyond here within the walls of VCU Health. And so thank you both for working with our families here and carrying our message and the work that we're doing in the communities that we serve. Thank you so much for that.
Thank you.
Reuben, talk a little bit about your role and what makes this month special to you.
I was just kind of thinking about that. And actually, I say over the last 20 years, I've had two roles here at VCU Health. I've been an IT professional and leader, but also I've been a patient, and all that time I've been using, the resources that this organization has, to keep me healthy. But I'll start off a little bit, with my professional role here. I am on the IT, senior leadership team, and my career progression has been mostly around applications, clinical applications, and at this time more ERP applications, or applications that make sure you get paid and make sure you get your HR benefits and things of that nature. But yeah, I'm an applications person pretty much. Also, I have a team that deals with what we call integration or interfaces, and that's connecting all the systems together that need to communicate with each other. So that's what I'm doing now. I'm carrying titles Director of Business Systems, but like I said earlier in my introduction, you can watch, I've had a career trajectory here, and I've learned a lot along the way. Again, all the way from patient transportation to where I am now. Again, this organization is a part of who I am, because of my tenure and devotion to the mission of this organization. What makes this month special to me, I was thinking about that, before the panel. One is an opportunity to educate. All right. It's an opportunity to express Thanksgiving. All right. And it's an opportunity to foster hope in the lives of individuals. Also, I would say it's an opportunity for me to testify, as some folks used to say in church. I got to testify. I have a story to say. I'm a witness of some things. And I think that's what makes this month important to me. I get to testify. I get to give my testimony regarding my journey. And also, it's a time to pray. Pray for people that are in challenging situations. Now, there's many of us that do these things on a daily basis, but this month is an opportunity to add focus and intensity to those things in regards to, donating life, being a recipient, and being a donor, and just being in that part of that I'll call it a continuum of life, so to speak, and bring attention to that. And there's more I'll get to say about this, but I was thinking about Harold the other night, and I was thinking about, how neat is it to know that you are an answer to a prayer? I had people at church praying for me, family praying for me, my uncle down in North Carolina praying for me. I didn't know he was on a prayer warrior conference call every morning at 6 a.m. People from New York praying for me, crying out to God, that kind of thing. So that's neat, Harold, to know that you're an answer to a prayer. So that's what the month means to me. Yeah.
Wow, Reuben, I can follow up that.
This is the get your tissue first portion of the program.
Absolutely.
Yeah.
That is profound. And I'm so grateful that you shared that, because actually my next question, Reuben, is directed at you.
Okay.
Walk us through your journey.
Oh, wow. Yeah.
Need a kidney transplant.
Yeah, and I want to give a what I think is something very, very important about kidney disease. Okay, you won't feel a thing. You don't feel a thing in those early stages. You'll be walking around with declining kidney function and you will feel nothing. All right. So that speaks to the importance of regular medical checkups. All right. I was so thankful for Dr. Kidd. I love Dr. Kidd. You know, as soon as he saw the downward spiral of my kidneys, he immediately told me, yeah, Reuben, you'll end up on dialysis. But he said, think transplant. You know, you're at the age, you're too young. Think transplant. But my key message is you won't feel anything. So don't wait until you feel anything to know your kidney function and know what's going on with you. What landed me in a situation where I needed to get a kidney transplant, you know, like people say, he got sugar and high blood. Okay, as people used to say, I had diabetes and I had hypertension, and that set up a perfect storm. Along with what I had was a sedentary lifestyle, resulting in that spiral regarding my kidney function and me needing to get a kidney transplant, and you know, preceding that me being on dialysis. Dialysis, I never forget, February 2019. That was the month where I had to get 3 major things done. First of all, I wasn't even healthy enough to get a kidney transplant, first of all. All right, but I had 3 things happen. I had to get the catheter for me to get on dialysis. I got on dialysis, and I had to get a coronary artery stents. Okay, so that was part of my journey, you know, to help get me healthy enough to even get a transplant. So you know, my doctor had educated me on dialysis. I was hoping that I could get a transplant before I ended up on dialysis, but I had to get on dialysis to be healthy enough to get the transplant. All right. Unfortunately, during dialysis, wonderful transplant team, wonderful dialysis team, wonderful nephrologist. But Reuben, something occurred in Reuben's mind where I developed a phobia to something that was helping me live, you know, and I'll just be frank about it. That's how the devil works, you know, really, you know, something that's good for me. In my mind, it was a lie that caused me to develop a phobia. And that's where my family came in, the church came in, every people praying for me, a lot of people praying for me. But during that time, I had latched on to Harold. And as I said in one of our prep sessions, I said, I gave Harold a role that he did not sign up for. Okay. And this is the part where it gets emotional. But Harold was already donating a kidney. Okay. But some kind of way I latched on to him and was asking him for so much more. When I was having bad days when I was having a bad day about my phobia regarding dialysis, when I was having bad days about, you know, my dates being need to be pushed out, I latched on to Harold, and he never complained. He helped me throughout that process. You know, he would send me verses, he would send me scriptures, he would send me sermons, he would send me, Reuben, hold on, Reuben, we're almost home. Reuben, it's going to happen when it's supposed to happen. So I gave him extra work. I gave him an extra job. He was already giving me a kidney, and I asked him to do so much more, and he did it. I know I've messed up and started crying, so I don't know where you're going to go with it now.
You did not mess anything up. Please.
We gave them the disclaimer when Dr. Davis started, so we told them.
You warned them.
Reuben, get your hanky. We already gave them that, so it's all good.
We did, Reuben. Thank you so much for that. I can't imagine what going through that was like for you, because I've never experienced that. And so I am honored to even learn from your journey. So thank you. Harold, I'd like to turn to you now.
Okay. Okay.
Thank you for turning to Harold. Try to get myself together.
I appreciate that. I'd like to ask you, Harold, how did you feel the first time you heard that Reuben needed a kidney? Did you know immediately that you wanted to help? And had you even defined what help looked like at that point? Reuben just told us that he felt like he asked you for so much more.
Yeah, the truth of the story, the other part is I did not have my hand up to be a kidney donor. That's not how this story went down. And for those folks that have watched the VCU tribute and video to what we did, that's online, that's great. But the real story was there were a bunch of other people that had their hand up that were trying to help Reuben, his family, church members, other co-workers, just tons of folks. And Reuben came to me several months before this and said, look, I just want to keep this close to the vest. I value your friendship. I want to share with you that I need a kidney transplant. So just please pray for me. That was the original ask. The original ask was just to pray for me. Keep me in prayer. And first of all, I was touched that he confided enough in me to share that intimate story with me. So that's what I did. And I had no desire to be a kidney donor. Didn't have my hand up, didn't have my hand waving, didn't go, I'll help you. No, not how it went down. Here's how it went down. After Reuben shared that with me, the next 4 days, I'm just going to call it what it is. The Holy Spirit set on me, but it was not a heaviness. It was not a burden. It was just, hey, dude, need to get your attention. I kept you here at this organization, unbeknownst to you, sometimes when you did not want to stay, because it was always not a fun place to work. We all know that. We have days, we have months. In my case, I had a couple of 3 years where it was not an enjoyable place for me. I didn't feel valued. I didn't feel respected. And there were some things going on. There was no victim mentality. It's just the honest way it was. I was not trying to stay here. I was trying to leave. And he kept me here. And what you have to remember is, if you are familiar with scripture, Revelations 3:7, I will close a door that no man can open, and I will open a door that no one can close. Now, that's pertinent because for those 4 days, I kept hearing this tap. Hey, dude, got something I need you to do. I kept you here through all the chaos, through all the turmoil, through all the ups, through all the up downs. I didn't let you get that job over there. I didn't let you leave the company and go to another place over here because I need you in a position that you don't even know you're going to be in. Didn't know. So right about day number 4, it's, oh, I think I'm supposed to donate a kidney. I didn't say, I think I'm supposed to be tested for donating a kidney. It came to me, I think I'm supposed to donate a kidney. Forget about all the other people that have been trying to help Reuben, his family, his daughter, his wife, his kids, his church members, people. So I talked to my wife. Now I gotta be very clear here. I put my wife in a very difficult situation because it was very selfish, and I want to be transparent here. Because when you leave with, sweetie, I think God is telling me I need to give a kidney, what are you going to say as a spouse? So you kind of hard pressed, right? But it wasn't, it was more of a, I think this is what I'm being called to do, and I believe it. And there is an important thing that people have to understand about us as Christians. We have learned to discern the voice of God. Christians know when it's God talking, and Christians know when it's Satan talking. God operates in peace, in calm, in stillness, never rushed, never in a hurry, not timelines. Satan wants you to be fearful, operate scared. He wants to rush you. He wants to tell you, he wants you to get in your flesh. He wants to give you all these reasons why you shouldn't do X or do something. So I knew that wasn't Satan talking. So I talked to my wife, and she said, well, it's your body. I said, no, we're married. This is our body. And I want you to be on board with it, and let's get tested and see what's up. She said, okay. So That started that process. And for anyone listening or for anyone considering to become an organ donor, you have to understand something. It is a process, but it is worth it. The downside is it is the best physical examination you will ever receive in your lifetime. They tell you which size your heart is, which size your lungs are, which kidney they're going to take, what your blood work is. There is not a test that Alicia can mention that I didn't have. And they give you a psych eval too, so they make sure you're okay. But it was an extensive process, and Maureen Bell and the people were tremendous. And this is the part that I get really, I'm in awe about it. I'm not even in awe about the kidney donation. I'm in awe about what he did for me to prop me in a position to donate a kidney. That's my awe. I was a heavy drinker. I was a cigar smoker for 20 years. Now, I wasn't a cute cigar smoker. I wasn't one of those people that puffed the cigar and then blew it out looking real cute. I inhaled the cigar and I love a good cigar. I put those down about 8-10 years ago now. But he was cleaning me up in preparation for something that he was going to do years later. That is the awe for me. He stopped me from doing all those things 5, 6, 7, 8 years before. Okay. Now, truth be told, I occasionally still have a drink to this day, but it's not something I beat myself up over. But my point is, I couldn't donate a kidney if I wasn't physically able to do so.
Yeah.
You just can't. You just can't go, nope, dude, I'm sorry. And all of this stuff. So we went through the process, and I made sure to tell Maureen Bell, our kidney coordinator, do not tell Reuben anything until you are 100% absolutely positively certain, tissue matching, and it's a wrap, that it's guaranteed. Do not say a word to him. And so she gave me that. And then about 45 days later, I was in my office. She called me on my cell phone. And she said, "You are a match." And the second she said it, I've shared this with some of you, I dropped my phone. It fell out of my hand. I ran to my office door. I slammed the door, slammed it, not closed it gently. I slammed it, and I just began to cry. I began to cry uncontrollably like a baby because I was so happy for him. All the people, he chose me. He kept me where I didn't want to be for a period of time. He was cleaning me up along the way. And he was moving obstacles and people to position me for a moment of his choosing. Now, that to me is powerful. And what I was thinking about, as I thought about that story, what occurred to me is organ donation is not about you. It's about the people that Reuben, I will never meet, that are touched by his presence. And I'll give you an example. I gave Reuben a kidney, check the box. Okay, we win. But Reuben gets to meet that new person this year that he might not have been able to meet, who then touches another person because they were touched by Reuben, who then shares that with another person who was touched by somebody else. And that we are all interconnected. We are an interconnected being, and we're not here alone, and being able to be a part of that. So I would encourage folks. I know it's scary. I know it's physically daunting for some of you, but be tested. Change your driver's license to donate. You don't have to give a kidney. Change your license. Be an organ donor. The good that you will do far exceeds not only you, but generations of people because of something that you did. And quite frankly, I think it's pretty darn cool to be able to help save some life. So that's pretty cool. That's my story.
Wow, what a powerful story, Harold. And, just thinking about our virtual audience today, for anyone who's listening, we have an opportunity to touch and educate and influence. And I don't take that responsibility lightly at all. And it is through your story, Alicia's work, that we are able to carry this message. And so that's something that I find incredibly impactful. So I appreciate both of you. Alicia, I'd like to turn to you.
Okay.
Being a transplant nurse, you are so close to families who are in similar positions. What do you say to the families? What do you think is the best thing for them to keep in mind? Or even when you go out into the community, you mentioned sometimes when you're in church, you hear myths, if you will. You hear people expressing that medical mistrust. What do you want them to know, to keep in mind as they think about being an organ donor?
I'm at a loss for words after listening to Harold and Reuben's story again. I've seen the video, but it's just, I don't even know how to speak after that. But I personally just want everyone to know that at VCU, life is important and it's powerful, and we do everything we can to help save lives. Unfortunately, sometimes the way we do that is through organ donation of a deceased donor. Sometimes we do that through people sharing the gift of life to strangers or to friends and being a living donor. But life in general at VCU is a precious gift, and everyone as a team works really hard to save lives and to can let that gift continue. I want people in the community to know that being an organ donor does not mean that we won't do everything we can to save your life if you come in with an emergency. That is always our goal. And I know a big part of the mistrust in the community is that when you come in through the ED, if you're an organ donor on your driver's license, that we won't provide care. And that is not the case. We will fight tooth and nail. And sometimes, unfortunately, we don't win. Sometimes God calls you home. And that is a part of this journey of life. And I want all of our patients to know that whether you're receiving an organ or giving an organ, your life is the end game for everyone. We're a giant, huge organization, but we're all a team working for one goal.
Thank you so much for that, Alicia. And as an organization, right, VCU Health, we acknowledge that there have been times in our history when we've fallen short, including the first heart transplant at VCU Medical Center. And that damaged the trust that communities place in us, that people place in us, especially the African American community. Now, to this history of a removal and transplant of a Black man's heart, Harold and Reuben, did this make you nervous in any way, being that that was done without consent? Did it make you nervous in any way about what you were about to embark on? Why or why not?
Reuben, please go.
Yeah, I've thought about that. I had already had a relationship of high trust with the health system, by being there so long and having my family taken care of here. I was, taken care of here. So though I acknowledge the history, I have acknowledged the efforts to overcome, that stigma through positive actions. So, I was putting my trust in, like I said, my nephrologist, the dialysis team that, I was a difficult dialysis patient, but they claim I won't. Okay. I mean, I asked to be disconnected from dialysis at least 4 or 5 times, because of that phobia and everything I was dealing with. So I had so much trust in the professionals at the organization that it canceled out, any negative historical events, though I acknowledge them, or I am aware of them, but the positive that I have experienced in my care, kind of, again, didn't make it so that it didn't occur, but it made it such that it was not a factor because I trusted the whole entire team that was providing my care. Mm-hmm.
I tell you, I think it's important to acknowledge what has transpired in the past and be aware of it But I would say to you that I put my trust in God. Mm-hmm. So I don't trust man. I don't trust the things of this world. So for me, when the decision was revealed to me, and I knew that it was God's voice speaking and not Satan's voice. Satan's voice like to remind you of those types of things because he wants you thinking about those things to cast doubt and create fear. So when I made the decision, or when the decision was revealed to me and it was affirmed, let me say it that way, there was not an ounce of doubt, regret, anxiety, fear, trepidation, second guessing. It wasn't. It was like, okay, that's what you were called to do. Oh, I get it. Let's go do that. It was just that simple. And I try not to overthink it, because what fear does, anytime fear enters the equation, fear is not of God, because God did not create a spirit of fear, but of power, of love, and of a sound mind. So anytime I hear people speaking about, you know what, I'm afraid, whatever they say after that, it ain't God. Now, that doesn't make them a bad person, but it's just Satan has a way of creating doubt in people, through other things that may have happened that position us to not do what is his will. And I believe with all my heart that it was the right thing to do. It was the moment to be done. VCU was the place that get it done. And Reuben was the recipient of God's will for what he asked me to do. I simply needed to be obedient. So I didn't think one iota about what transpired and all of the inequities that have happened in our VCU history as we work to not eradicate them, but change the trajectory of the population that we predominantly serve, being an urban academic medical center. Yeah. And so it is absolutely imperative that we recognize it and we don't forget it, but we need to speak to the momentum of the moment and continue moving forward. And I would encourage folks to consider organ donation, just consider it. It's something that you would, the value to you, I can't even speak. It fills you with a joy, not a happiness, but a joy. Every time I see him bouncing around like a 12-year-old kid, right? Because what you don't know, for those people that have never been a part of this, as an organ donor, living organ donor, the organ donor feels worse than the organ recipient the day after surgery. I felt terrible. I'm looking at this dude walking around, running around the hospital. I'm going, what are you doing? I feel terrible. He's bouncing around. I was like, oh, I get it now. He got a new kidney. He's flying around like a 12-year-old on a scooter, and I'm just kind of creeping along. It was awful. I was kind of upset with him for about 13 seconds. I looked at him, like, how is he so bouncing around? But that's what happens. But I'm so happy for him. I am. I'm happy for his family. I love his mom. His mom, she'll ping me. She'll send me a card in a minute. I'll go to the mailbox. Thank you for saving my boy. Doesn't matter. So it's awesome. It is neat. And the best thing that Reuben can do for me to say thank you is live to be 110. Live to be 110. You don't have to tell me thank you. You don't. If our paths somehow separated and we're inextricably linked, I get it. But that's how he says thank you to me, by maintaining an active lifestyle. That sedimentary lifestyle, change that, keep it moving, enjoy life, and just that. I think that's the best gift that he can give me. So there you go.
Yeah, I got to say something after Harold said that. What Harold, when he was talking about that fear and how he was dealing with fear, that was part of what I was tapping into. That's what he was helping me with when he was saying those phrases. It's going to happen when it's supposed to do. Hold on, Reuben, and sending me those verses. That's what, in the position that I was, in the state of mind I was, him being my donor, that's what I was tapping into. That's what he was giving me.
Wow, that's so powerful. I appreciate both of you sharing that. And the fact that, Reuben, the scriptures and the mentoring, the friendship, the Bible, your belief, your faith, all of that impacted the Bible teaches us no fear, only faith, right? And that is what continued to build up your strength. So thank you for that. I appreciate it. I'd like to ask another question based on your collective experiences. And Alicia, I'd love to start with you. What opportunities do you think exist here at VCU Health System to educate individuals, and particularly individuals from the African American community, educating them about organ donation, both on the side of being an organ donor and a recipient? Alicia, I'd love to.
Yeah, no, I think VCU is really good about getting out into the community. We sponsor a lot of events, and I think we can go further. We actually have a donation awareness committee who's making it a point to go to churches in the community like St. Paul's, to do events, any kind of health fair. I think we just need to talk, to just never stop talking, never stop sharing, invite as many of our amazing friends like Harold and Reuben to speak. And it's so special because you're already part of VCU. So, I think we need to just be a light in the community and to just spread ourselves out as far as we can.
Marcel, to Alicia's point, what I believe we could benefit from is the exceptional marketing ability that VCU has around how they do what they do, whether it's basketball, whether it's programs academically. We have a tremendous marketing effort, and I would like to see the program not just once a month, but something, when you're driving down 95 and you're coming into Richmond and you see this is Ram Nation, have something up there about organ donation. Have something up there about another aspect of the organization that we need to know about, not just sports, but a comprehensive campaign year round to build awareness about the excellence that is VCU. We are a nationally recognized organization with a level 1 trauma center, and all the other hospitals send their patients to us. They do that for a reason. And I would like to see us embark on more of not just once a month campaigns, but a year-round comprehensive strategy, because organ donation it's a big deal. It's powerful. It's life-changing. It's cool. It is very cool. And I think we need to tell that story, not just this month, but I think we need to tell that story every month. And it is exciting to be a part of it and to be a part of this organization.
I just want to add one thing that you just reminded me of, Harold. This is something that I'm really proud of, and I don't think the community is as much aware of it as they should, but every time we have an organ donor, there are billboards on 95 and 64, I believe, that actually show up with the Donate Life logo, and that is to honor our donors and recipients. So I think we should advertise that, but that is something I'm very proud of, because every time I drive by, I think we are doing something great, and the community is helping each other. So
I had no idea about that. Alicia, thank you so much. And I'm taking notes, you all, so I will go back and take the information back, the ideas back. Alicia, thank you. I had no idea about the billboard.
Thank you.
Yeah, of course. Reuben, did you want to weigh in on this question?
Oh, the only thing I would say, or what I've been thinking about, is this journey is part of my story, part of my narrative, and in every forum or whenever I get an opportunity to add it to what I'm doing, I share this. So each one teach one, Reuben tell one, Reuben tell many. That's kind of the way I am. And I even think I just finished a series of Bible studies, and I brought my dialysis experience into that Bible study. I had preached a sermon not too long ago. I brought something about that in that. How I had to put my faith in God, and really what Harold was talking about. I see the sovereignty of God in what has happened, with me and Harold. And I had to go through a tough period. But for Reuben, it was tough, those 5 months on dialysis. But my faith now doesn't even, my faith now is so much greater than my faith was before I went through that experience. So, the Bible is right about you growing through trials and tribulations, as my late grandmother used to say. But the point I would make is we got to tell people. I like telling people how I feel, okay? And I am not exaggerating, folks. This may not be everybody's experience, but I feel 10 to 15 years younger. Okay. Guess what? Reuben is not sedentary anymore. Okay. I'm running behind Harold trying to, do what he's doing. You know what I mean? Not there yet, but I am not a sedentary person anymore. And I just want to tell them, I've grown both physically and spiritually and emotionally through this process.
That's as good as it gets right there.
I'm saying, I would say that's really powerful.
That's we go through this world, and the thing that touches my heart is that I work in IT, but I am not a social media. I don't do the face. I'm just not very. It's something. This generation of look at me has created this intrinsic selfishness to get folks that they can't see beyond what they are. And we as a people, not just African Americans and brown, but all people, we are at a tremendous crossroads culturally in this nation where we have to be able to reach across the aisle and help other people, regardless of skin color, and just do the right thing, because we are connected. I'm just as connected to Alicia as I am to Reuben, as I am to Marcel, and we just met. We're still connected because there's something that inherently creates a bond between us, and that is the bond of humanity, compassion, and love. And I don't care where you're from. I don't care what your skin intonation is. It doesn't matter. We are human beings, and we have a responsibility to care for each other. And you can do that simply by being kind. You can do that by giving blood. You can do that by changing your driver's license to an organ donor. You can do that by going to put your hand up to get tested to be a living donor. You can do that by being kind and just going to visit someone in the hospital. You can just be kind by saying hi to the person that you pass in the street. Just be kind. Yeah. We have a responsibility because we did not get here by ourselves. We didn't pull ourselves up by our own bootstraps. We're not as smart as we think we are, and we need help. So we need to be humble because a lot was done before we got here.
Great. Well said, Harold. Thank you so much. I always like to end the questions with a call to action. So Maya Angelou said years ago, when we know better, we do better. So if any of you had an opportunity to be a spokesperson for organ donation or organ receipt, what steps would you advise us to take to remove the barriers that currently prevent African Americans from getting transplants, particularly knowing that a Black organ recipient doesn't have to have a Black donor?
Hey, I'd like to say one thing. I wish there was some kind of recipient and donor like society or group that got together and talked. You know what I mean? Like people struggling with addictions and things like that. They have groups that they get together and just talk. And there may be, I may not be aware of it, but something like that. And then something a little more broader where you have people share the joy publicly like we're doing now. Have more of this is one thing. Have more of this where I can tell people how I feel and how I'm blessed and again, testify so people can hear me testify. And I hope, for them to get hope and joy and wipe away fear, hearing the story of somebody that's been through the process. So more of this, more of this.
Reuben, thank you for sharing that. I appreciate it. Alicia, how would you advise us?
I think I 100% agree with Reuben. I think the best way to get community trust and to inspire people is to share stories. And I would love to see just every opportunity for folks who have been through this process to testify and give their actual experience. I really think that trust will come from seeing people who look like me, or other, Black men and women, brown men and women. I think that is the best way to instill trust, is to show that we're all different but the same. And a kidney is pink. It's not black, it's not white, it's not Asian. It's just, this life-giving organ, but it's, I can give my kidney to anyone and they can give their kidney to me, and we can all just live this amazing life if we, take the opportunity.
The essence of the lack of trust is created by an expectation that has either been unmet or broken. And because of that, we have to restore it. And the way we restore it is through repeated examples and stories and educational opportunities to reframe the narrative. Because if I don't trust something, either I don't trust it or because I have been an expectation that was not met, or it was because I don't understand it. And if I don't understand it, then I'm going to make up my own story about it to supplement my current belief system. And if my current belief system is already like this, and I'm uneducated about it, and I've had a bad experience with it, I'm not going to trust it. So that's why I believe we need to do more campaigns, because there are fascinating stories out there of people just like Reuben, just like myself, who've done the exact same thing, but no one knows about it. And being able to put them and elevate their platform so that they have an opportunity to share their story, I think it'll simply just reinforce, and it becomes another brick of credibility that you can slide into that foundation that you're rebuilding. And before you know it, that foundation is solid, and all of a sudden you're going to have more people wanting to donate, more people becoming, oh, I didn't know that. Oh, now that I know that, okay, I'll go do that. And they get educated. So that's how I believe we win, and we win together. Reuben will love to go speak anywhere. Just let him know what time to show up.
Yeah, and he'll dress up for it, but he might not keep it on.
And one last thing, I've heard this, before folks can have a testimony, they have to be tested, and they have to have a test that becomes a tribute to their testimony. So that's a great thing. So thank you for having us again. It's been an awesome experience.
Thank you so much.
Thank you very much.
Yeah.
No, truly, I'm humbled by this experience. I'm a firm believer that I'm a better person today than I was yesterday because of all the learning that has come around me and before me. God has a funny sense of humor, and he never makes mistakes. So I'm grateful. I feel like I was incredibly privileged to chat with you all today, to hear about your story. I am fortunate to be in the role that I am, to talk about the things that we talk about. Having diversity, equity, and inclusion at the core of everything we do is critical, because Alicia, you said it, a kidney is pink. It's not black, it's not brown, it's not Asian, right? And I think once we recognize that we're all here for the good of each other, for the good of humanity, I think we can move past all of those senseless acts of hate that we see around us every single day. So thank you for that. Thank you to our virtual audience. If you need an organ transplant, know that your transplant journey will be led by national leaders committed to providing the best inpatient care. VCU Health Hume Lee Transplant Center care is compassionate, and our outcomes are excellent. and we have the most brilliant people here. Thank you for your time. To learn more about our transplant program, visit www.vcuhealth.org/Hume Lee Transplant Center. Thank you again for your time. I'm honored, and I appreciate all of you.
Thanks for having us.
Thank you. It's a pleasure
Thank
to
you
be
very
here.
much.
Have a wonderful afternoon.
Thank
You
you.
too.
You too.